Hi everyone, welcome to chapter 2. It's Dr. Shields speaking, and I want to go over this, PowerPoint with you. Altered cellular and tissue biology. So at this point, up to this point, you've learned a little bit about cellular biology as far as the normal, just a little bit of a review. So we're going to talk about the abnormals. So just some general concepts I'm going to review with you as far as pathophysiology. So you must understand cellular processes to understand diseases, and that's why we're starting at the cellular level. You just did chapter 1, like I said, which is normal, and then we're not going to talk about just some what happens when the cells get damaged. We're going to talk about injury. They're just very remarkably resistant to injury, and that's a big part of this presentation. Pathophysiology is study of the disorder or breakdown of the human body's function. So cells do get injured, and they either going to adapt to their injury and reverse the injury, or they're going to die. Or the third thing, they'll proliferate and turn into like a neoplasm. Disease occurs when there is a disruption in homeostasis or deviation from normal. So cells are exposed to noxious, persistent stimuli, which we'll talk about, which include things like smoke and pollutants and radon and asbestos, sun, weathers, chemicals, medication, just multiple things that can continually bombard our body. Pathogenesis, genesis in the beginning, is the development of evolution of a disease. So when we talk about pathogenesis, it's the mechanism that leads to the disease. So this can be affected by time, right? So as far as what the time frame is, quantity, how much of the disease is occurring, the location where it is, morphologic changes, structural changes that occur, things like something can be genetic, it can be caused by genetics, it can be caused by environment. So there all are variables in regard to the evolution or why a disease develops. Clinical manifestations include signs and symptoms of the disease, stages of the disease. Is the disease acute? Is this disease chronic? So the first thing here is, you guys talked about this in the last chapter, and you watched a video that talked about mitosis and how a cell actually goes through these phases, and then cytokinesis, and now you have one cell that becomes two cells, the two daughter cells, and then this process just keeps recurring and recurring and recurring over and over again. So when we talk about proliferation, know that terminology and understand it as replication, cell replication. So they're normal human cells, and they develop through the rules of mitosis, which is what you learned. And it's triggered by a signal to stop and start, and that's what we call proliferation. Cell differentiation, okay, there's two different terms. You should know the difference between cell proliferation and cell differentiation. It's a process where a less specialized cell or a proliferated cells become different, and they become more specialized. Okay, so these are cells that have proliferated, and it begins after they're fertilized. They go from just a general stem cell like this to a specific cell. So this stem cell is made through proliferation, and then it differentiates. So it either becomes like a nerve cell, or it becomes an enterocyte, or it becomes a hepatocyte or a liver cell, or it becomes a heart cell, or it becomes a bone cell, or it becomes a blood cell, a white blood cell, multiple different cells, and that's what we call cell differentiation. So let's talk a little bit about injury to cells. So we talk about cells now that are going to become injured. and it leads to tissue and organ injury. So cells make up tissues, tissues make up organs, organs make up our body. When there's injury to these cells, then there's injury to tissue, there's injury to organs, hence we have disease. A normal cell can adapt to physiologic demands or stress to maintain homeostasis. So when a cell is injured, it can adapt, and we're going to talk about cell adaptation coming up. Adaptation is a reversible, structural, or functional response to both normal or physiologic conditions, and I'll give you examples of those, and adverse or pathologic conditions. So cells are injured, okay? They get injured and they can adapt. And sometimes the response is a physiological response, like the uterus getting bigger during pregnancy, right? We adapt, the body adapts to pregnancy, the uterus adapts to pregnancy. Or it can be a pathologic adaptation. Maybe the ventricle starts to get bigger and bigger and bigger because the patient has hypertension. We would consider that adaptation. The muscle, the cells and the organs, the cells and the tissues of that muscle are adapting to the condition, and it's a pathologic condition. Injury may be reversible or irreversible. We're going to talk about that. Cellular aging causes changes that eventually lead to cell death or a decreased capacity to recover, and that should say from injury. So let's talk a little bit about this slide right here in cellular adaptation. And like I said, cells are remarkably resistant to injury, and tissues can adapt, okay? So they can adapt and be reversed and go back to a normal cell, or they can not be able to withstand the injury. The injury is severe and progressive, so it becomes irreversible. And what happens to an injury that can't, or cell that can't reverse its injury? The cell is going to die. And we'll talk about the different types of cell death. And I actually could put another third thing over here if you want to add, which would be sometimes when a cell is damaged, it could just ignore the rules of proliferation, which we talked about in the last chapter for mitosis, and it just continues to differentiate and differentiate and differentiate. And when these cells just differentiate and change their shapes and their numbers, they look completely different than what they should be, we call that cancer. It turns into a cancerous cell. So the cell can die or it can become cancer. So let's start up here. We have a normal cell. There's stress on the normal cell, and our cells are always trying to stay into a mechanism or a mode of homeostasis, always trying to be balanced in the perfect spot. Stress occurs, and so the cell is going to adapt. It's going to adapt. If it can adapt, then it adapts to the environment, and we consider it reversible. So if the cell doesn't have the ability to adapt, then an injury, a cell injury occurs. If a cell injury occurs and it's reversible, and we'll talk about things that are reversible and things that aren't reversible, they have a mild injury and it repairs itself and normal cell homeostasis again. Like, for example, a trauma. You cut yourself. Your cells are put under stress. Like I said, pregnancy, a broken bone, somebody has a myocardial infarction, and that myocardium becomes hypoxic, and there's low oxygen. The cells become damaged, but it's a reversible MI. The myocardium repaired itself. Okay, so these things can happen. They can be reversible, and we have this system right here. Or once the cell is injured, okay, a cell can be injured like by a trauma, like a nerve cell gets injured, the spinal cord gets torn, and it becomes severe and progressive. Somebody has an MI, and that part of the myocardium becomes anoxic, hypoxic, and ischemic, and then it becomes necrotic, and it's dead. It progresses into an irreversible injury. An irreversible injury, again, is going to result in cell death. And the two types of cell deaths we'll talk about are going to be necrosis or apoptosis. An abnormal cell death, apoptosis, a normal cell death. Again, we can have this third little wing coming off here, like I said, cancer, which is going to be a whole different lecture in a whole different chapter. So this is really what we're going to focus on here. So let's start talking about cellular adaptation. These are terms you should know. You have heard them, you've learned them, you might remember some of them, you forget some of them, but certainly these are important basic terms to know in regard to cells and pathology when pathology comes back. So we're going to talk about atrophy, hypertrophy, hyperplasia, metaplasia, dysplasia. All of these conditions or all of these adaptations, first of all, it's important to remember, are reversible. Okay, these can be reversed. If we take away the stimulus that's causing this problem or this adaptation process, we take that stimulus away, regardless if it caused atrophy or dysplasia or anywhere in between, they're all reversible. These last three here, put a little asterisk around it, the hyperplasia, the metaplasia, the dysplasia, these can all progress into cancer, okay? If the stimulus isn't taken away, doesn't mean they're going to be cancer, but they certainly can progress into cancer. But again, I said earlier, they're reversible. They can be reversible depending on the amount of stimulus, like I said, the time, how long has the stimulus, how long has the smoking been going on, those different things, how much damage is being done. They can progress or they can adapt. So let's talk about all of these and give you an example of all of these. So make sure you take some notes on these because it's again, like I said, this is important terminology for you. So atrophy, which is a pretty common one to remember, is a decrease in cell size and number, or it's a shrinkage. So I'm going to kind of go from this slide to this slide. This is just a little slide or a little row of normal cells that we talked about in chapter 1. And this one right here are the cells that have become atrophied or they've shrunk. And this is very common in skeletal muscle, cardiac muscle, heart can become atrophied, sex organs due to a lack of hormone, they certainly can become atrophied. Due to age, they become atrophied. Brain tissue and cells become atrophied often because of age. The skeletal muscle, an example would be something you're probably familiar with, somebody who has a broken arm and they have the arm in the cast. That muscle has a decreased demand on it. There's no demand on that muscle. They're not using it. It's shrinking. And they get their cast or arm out of the cast, and hence they got a little skinny arm. And obviously that can be rebuilt. We can increase the demand on the skeletal muscle, and that muscle will rebuild. It will reverse itself. Sometimes it's not reversible. Somebody has a spinal cord injury and they become paralyzed, and from the waist down, for example, and their legs just shrivel up. Their legs just become atrophy. That's not reversible. That's permanent damage. The second one is hypertrophy, and hypertrophy is an increase in cell size, okay? It's caused by an increased demand. So it's not an increase in number, it's an increase in size. Now these get bigger than they're supposed to be. So when we talk about hypertrophy can either be physiologic or pathologic. I kind of briefly spoke about this, and a physiologic hypertrophy example would be something we see every day, somebody who's lifting weights, and their muscles, the cells, the tissue of the muscle, they have an increased demand, increased workload, and the muscle cell gets bigger and bigger and bigger, and it's a normal response, weightlifting, physiologic hypertrophy. If they take that stimulus away, those cells would shrink back to their normal size. There's pathologic hypertrophy. Pathologic hypertrophy, an example that I gave earlier, which is probably one of the best ones, is ventricular hypertrophy, which you've all heard of, okay? Ventricular hypertrophy, again, is caused by hypertension. So as that left ventricle tries to continually pump blood through that aortic valve, through that aorta, through that system, through that arterial system, and that arterial system pressure is high, 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 that left ventricle has an increased demand or increased workload on that part of the muscle, and that muscle gets bigger and bigger and bigger, just like somebody's arm muscle did because they lifted weights. So it responds to the increased demand of heavy work. The third one is hyperplasia, and hyperplasia is an increase in the number of cells in the organs or tissues. And you can see here, it's not that they got bigger, it's just that they became more. There's an increase in the number of cells. So don't get these two confused. They are not the same thing at all. It results from an increase of cell division. We talked about cell division in chapter 1, an increased rate of that cell division. Those cells divide, they just proliferate quicker. And the main mechanism of this hyperplasia, or this increased rate of cell division, is often an increase in some type of growth factor. So some examples of hyperplasia that we see. If you know or seen anybody with psoriasis, you see the skin, it just keeps proliferating in these layers of tissues. The epithelium just keeps getting more and more and building upon itself and building upon itself, and they get this high kind of a raised, crusty type of a skin issue going on. A mole is an example of hyperplasia. It's raised. It's just this tissue that continues to increase in size. Another thing is like a callus on your finger, your pencil, just always rubbing on that callus. It's responding to the environment. It's responding to the stimulus, and it's compensating. It's actually kind of compensating. And a callus is more of like a compensatory type of a hyperplasia because of that pressure, and so it's building that thickness there to kind of protect your finger. Another example, while I'm on hyperplasia, you're going to have to put a kind of a side note here. It's just kind of interesting. Another example of what we call compensatory hyperplasia is, like I said, like a callus, and it's an adaptive mechanism that allows an organism to regenerate. And I bring that up because liver regeneration is something that occurs. The liver is the only organ that can regenerate. We call that compensatory hyperplasia. So somebody has some type of liver disease, they get part of their liver removed, they cut their liver off, that liver will regenerate. That's an example of compensatory hyperplasia. And like I said, it's the only organ that does that. So cells increase in number of cells. The next one here is metaplasia. That might be a little more unfamiliar terminology compared to the first three. And it's a differentiated cell is replaced by a different type of a differentiated cell. So one cell replaces another cell, and you can see it right here. These squamous cells are the cells that are supposed to occur, but these are replaced by maybe some epithelial cells or a different type of cells. So it's a replacement of a mature cell type, not in really like the growth of it, but a mature cell type gets replaced by a different type, like an epithelial cell by another epithelial, less differentiated cell type. And the reason this occurs, it's an adaptive mechanism for the cell, and it makes the cell more suitable to the environment that it's in. So a couple really good examples of metaplasia. Number one of them is GERD, somebody who has gastric esophageal reflux disease. It damages the squamous epithelium in the esophagus, because that esophagus shouldn't have acid in it, and it doesn't like those types of cells. So after a long time that it's being bathed in hydrochloric acid, these cells will change. They'll change to a totally different cell type that tolerates the acid. Okay, and that's metaplasia. So keep in mind, metaplasia is reversible if we take away the stimulus. For example, in this case, we treat somebody's GERD, and then that esophagus isn't bathed in hydrochloric acid, or if we don't treat it, it could progress, and it could progress into cancer. Another example, a very good example of metaplasia would be somebody who's a long-term cigarette smoker. So they have a chronic irritation from the smoke, and it causes like the normal ciliated, these columnar, and that's actually what this picture is right here, these columnar epithelial cells of the bronchus and the trachea. That's what these cells look like in our bronchi and in our trachea, and it becomes replaced by a stratified squamous epithelium cells, a different type of cells. And they don't have cilia, and they don't have mucus producing capability, so this tends to be less protective mechanism for the person, and they may be more prone to viruses and different things like that. Again, if we take away the stimulus, in this case, the cigarette smoke, these can change back to their original, okay? So this is adaptation. They've adapted to the environment, whether it's the GERD or whether it's the cigarette smoke. That cell tolerates those things better, but once the stimulus is removed, it can be reversed and it can go back to its original cell. If the stimulus isn't reversed, it can again progress to cancer. Oops, sorry. So the last one here is dysplasia. And dysplasia are cells of a different size, shape, and appearance. They may have DNA damage, lack of apoptosis, which is apoptosis we'll talk about in a minute, which is a natural cell death, growth without growth factor. So the cells are growing and they're replicating and replicating at a very fast rate. And these are dysplasia right here. So cells of a different size, a different shape, and just an overall different appearance. So sometimes somebody gets a biopsy and they do a scrape of the uterus or the endometrium or some inside the lungs in a bronchoscopy or something, and they send these cells, or the skin, oh, that's another very, example, send the skin cells, and they look under a microscope and they don't look like what the cell is supposed to look like. They look completely different size, shape, and appearance, and they're called dysplastic or dysplasia. And dysplasia is not really a true adaptive process. It just develops this disorderly architecture because of some type of a stimulus. Now, keep in mind that dysplasia is not a cancer, but it certainly can progress into cancer. So anytime the biopsy is done or a scrape of cells is done and they come back dysplastic or dysplasia, that's generally a cause for some concern to figure out what the problem is and get this reversed. If it's mild, it can be reversed. So again, screenings are done to detect these things early, because when we just detect these increased proliferation, which this could certainly progress into a neoplasm, we want to get it early so it can change back to its original cell. So again, can be reversible if it is mild. So this picture right here is what we call neoplasia, which we consider a malignancy, and dysplasia can progress into a malignancy or neoplasia. Hyperplasia can progress into neoplasia. Metaplasia can progress into neoplasia or a malignancy. And you can see a malignancy occurs when these dysplastic cells have broken through the basement membrane of any type of a tissue or organ. So when the dysplasia penetrates, you can kind of see here, there's a cell. The cell gets a mutation from whatever, cigarette smoke, a hormone, estrogen or something, maybe we're talking about cervix, breast, some type of a mutation occurs. Here you see some hyperplasia occurring. It progresses into these dysplastic cells right here. We call them dysplasia, which can, again, remember, we can reverse this. This is why we do screenings. We can reverse this. If we don't, it can progress into what we call an in situ cancer. And when dysplasia penetrates the basement membrane, it's an invasive neoplasm, and it's called in situ cancer or carcinoma in situ. Again, at this point, we want to remove the stimulus, the hormone, the cigarette smoke, the toxin, whatever it is that could be causing that, to hopefully, stop the progression. If not, the progression continues and it metastasizes. And metastasize now doesn't mean that it just penetrated the basement membrane. It penetrated all the way through. Now these cells penetrate all the way through, and the little cells get into the vessels and they travel around. And now these cancers that started in the kidney have moved and lodged into the lung, or lodged into the bone, or lodged into the brain. So this is kind of the progression right here. And this is just another example: cervical dysplasia, abnormal cell growth of the cervix. And that's why women get pap screenings, pap smears for screenings. We have normal cell growth right here. We send it to the lab, and the lab looks at it, and this is what it looks like under the microscope. This is mild dysplasia right here, so a little bit dysplastic as far as their cells, different sizes, different shapes, they look different. Mild dysplasia, hopefully at that point, again, there can be an intervention if we're doing screening. If not, it will progress into a moderate or a severe dysplasia, and you can see more cells of different size, shape, and appearance. And often surgical procedures are done. And if it progresses, now it breaks into the basement membrane, and now it becomes cervical cancer. Okay, so let's talk about cell injury. We just talked about cell injury and how the cells can adapt, that they can adapt and go back into their normal cell and go back into homeostasis, or they don't adapt and they can progress into cell death, which we're going to talk about, or they can progress into carcinoma or neoplasm. So most disease start with cell injury, whether it's diseases, trauma, environment. Can be reversible or irreversible, right? So, and the only thing that's not reversible will be like a neoplasma, or generally a dysplasia that has been broken through the basement membrane, the cancer in situ. Something else that couldn't be reversible would be some type of permanent damage to a nerve cell, like a paralysis or something like that. But generally for adaptation, they can be reversible unless it's cancer. Normal states, it's balanced with cell renewal. Again, always striving for homeostasis. So what are some things that can cause cell injury? This is a little picture right here, and the next slide talks about it again. Anything that causes hypoxia to the tissue, physical, chemical agents, poisons, drugs, toxins, cigarettes, environment, alcohol, infections, and immunologic type of causes. Somebody gets a staph infection in their skin, and you've seen it. Genetics, there could just be a genetic predisposition for somebody to have a genetic mutation, which is the DNA becomes damaged, and it changes and it proliferates into some kind of cells that are unrecognizable. It could be nutritional deficiencies, like vitamin deficiencies. Obesity certainly can predispose to cell injury. And this slide is pretty similar as far as causes of cell injury to that picture. physical agents, mechanical forces like trauma, extreme temperatures like burns and frostbites, electrical agents can cause cell injury. And your book goes into just real detail about every single one of these, and I'm not going to do it. You can certainly read up on it if it interests you, but just you understand that these are mechanisms of cell injury and trauma and disease and things that we see all the time. Radiation, ionizing, ultraviolet, non-ionizing, regardless, radiation changes the cells. They change the DNA, and that can certainly cause a cell injury. Chemical poisonings and drugs, like I said, drugs and alcohol and any types of poisons, smokes, anything from the environment, those types of things. Biological agents, and then we talked about nutritional imbalances like vitamin deficiencies and obesity. So we talked about cell injury. We talked about the causes of cell injury. Let's talk about the mechanism of injury. What is the mechanism of this injury? What happens when this person has an injury? They can have a hypoxic injury. The hypoxic injury will cause ischemia. Then it will cause anoxia. Then it will cause necrosis, in this order. Hopefully we can intervene here and it can reverse. We can intervene here, it can reverse. But if we intervene, we can't intervene at a certain point, and it's just going to be dead tissue. So a decrease in blood flow to any tissue or organ, decrease oxygen, decrease nutrients. An example of this would be a blood clot. Somebody has a blood clot, so the blood, this oxygenated blood, can't get to those cells and those tissue, and they become ischemic, anoxic, and necrotic. And remember, necrosis is damaged or dead cells, and they cannot survive. We cannot reverse necrosis. Reperfusion injury, we replace the oxygen, so we want to open up, get rid of that blood clot, right? Remove that blood clot, get that oxygenated blood there. Also want to talk about something called free radicals. And that's kind of coming up in the next slide. And when we talk about free radicals, we're talking about like a reperfusion injury that can be damaging to a patient. So let's kind of break this slide down here. So the first thing we have here is a hypoxic injury, and it's reversible. So it's a reversible hypoxic injury. So it can return to a normal state, okay? Whereas an irreversible hypoxic injury is going to result in cell death. That just makes sense. Think of that blood clot. You don't need to memorize this, but how it begins is we have this lack of oxygen, and all of these processes take place, and your book talks about all of those, but this is what takes place at a cellular level. So we have membrane permeability increases, so water leaks out and the cell swells. The pH goes down, it becomes acidotic. Mitochondrial function decreases, so disturbance of the metabolism, the outcome, which is energy. Poor protein synthesis. So all those things that you learned about the cell, obviously those things aren't occurring. And so we have this cell that's just dying to get oxygen. We can reverse it, and it can go back to its normal state. Whereas an irreversible hypoxic injury, again, we kind of move on. The increased membrane permeability, the decreased intracellular pH, that just progresses. This is just a progression down here. Instead of reversing, it just progresses down here. We lose the RNA, the proteins, destruction of lysosomes, enzymes leak, digestion starts eating its own cell components. We have membrane damage, mitochondria isn't functioning, the organelles are all degrading and breaking down. Hence, we have cell death. The cell dies. We can't bring it back. It's the point of no return. Reversible cell injury versus irreversible cell injury. So reversible cell injury, the type of cell injury that can return to the steady state by altering cellular conditions, we talked about that, can return to the normal position. Sublethal and short-acting, caused by lack of oxygen, which we talked about as hypoxia or ischemia, or blood flow to the cells. It does result in the cellular swelling, fat accumulation, and it's treatable, okay, if we reverse it. Irreversible is just that second picture I showed you. One of the severe types of cell injury always leads to cell death. Okay, if you have a necrotic part of your myocardium, it's going to die. If you have a necrotic toe, it's going to die. Has passed the point of no return. It's lethal. It's long lasting, caused by immunological responses. Viral infection results in necrosis and apoptosis, which are both cell death, and leads to permanent cell loss. So it's just kind of a summary of the two pictures that I showed you up above. Now, the reperfusion injury, exists independently, and what happens is the cell is just the cell that kind of, if you kind of look at like a free radical, we'll talk about free radicals, but a reperfusion injury have bloodstream, the neutrophils, goes into toxic oxygen radicals, calcium loss, cytokines, cell damage, cell death. And the example I have here is an acute myocardial infarction. If there's no treatment, you can see the end product right here. Cardiomyocyte, the heart cell dies. Fibrosis occurs. Inflammation occurs, okay? So that's irreversible. And here's some ischemia. They have reperfusion therapy. We give them oxygen, the cell regenerates itself, and the capillary is protected, inflammation goes away, the cardiomyocyte or the heart cell survives. But a reperfusion injury is a little bit different. And let me see if I have another slide. Oh yeah, okay. This is what I was wanting to say. So reperfusion injury also can occur in cell death. So this slide right here, we talk about free radicals, and free radicals are molecules, and they have a weak bond, which is like just like a single unpaired electron, and it makes the molecule very unstable, and it damages the DNA. And I'm kind of missing something here. So we have this oxidizing that can occur in the body, and that's what this is right here, reperfusion, and it causes cell death. And this reperfusion injury or this oxidative stress, these cells become, like I said, just one unpaired electron. It plays a role in aging. It plays a role in diseases like diabetes, autoimmune, infertility. It can be caused by, this oxidative stress can be caused by pollutants, by radiation, like herbicides, chemicals, cigarettes, just multiple things in the environment that can cause this reperfusion injury or this injury in our body that can cause cell death, because these free radicals are produced by this oxidative stress on the body, and these free radicals go around and they just cause injury to the cells, and hence we have these diseases that I talked about. So some free radical generating substances, things that can increase free radicals in our body, which are those single little unpaired electron, those molecules that are going around that's damaging DNA, and that's causing this reperfusion injury right here, which is going to lead to cell death. Fried foods, tobacco smoke, alcohol, air pollutants, pesticides. And so you've kind of heard about free radicals. And one way to combat free radicals or neutralize these free radicals that are caused by oxidative stress from these substances right here is to take antioxidants, foods, supplements that have antioxidants, which kind of neutralizes out this free radical, and it prevents some diseases. It can slow down aging, things like that. So that's just the best way that I can explain free radicals without giving you pages and pages of information. So let's talk about cell death. So we just said that cells are either going to adapt or they're going to die. Okay? Now keep in mind too that cell death is a normal part of life. We have cells that are dying every second of every day in our body. We just don't know it because it's just a natural process that's going on. So we're going to talk about two types of cell death. One's called apoptosis and one is called necrosis. Apoptosis is more of a physiologic type of cell death, and necrosis is a pathologic type of cell death. So this is something that's a disease process right here, where this is physiologic, this is normal physiology. So apoptosis is the process of eliminating unwanted cells. Naturally occurring causes cellular death. It's the natural cause of cellular death. You have it going on, I have it going on. Important in tissue development, immune defense, and cancer prevention. Like if we didn't have apoptosis, we would all have cancer because these cells, when they become irregular, then our body just apoptosis occurs and the cells die. So sometimes that's why people get cancer young, and sometimes people get cancer old, or sometimes people never get cancer. Again, a lot of it is in regard to genetics and your body's immune defense and ability to kill those cancer cells. There's single cells, there's no inflammation, or internal and external factors. So this right here, what happens, and I'll show you a picture of it, the cells shrink up and die, just in little intervals, one here, one here, one here, one die, one die, one die. Not big clumps of cells, just single cell death that doesn't cause any inflammation. The second one, necrosis, is premature death of multiple cells, not single cells, multiple cells. Necrosis is always caused by external forces. These can be internal or external forces. Internal like cancer, external like a sunburn, okay? Necrosis is always caused by external factors such as ischemia, infections, toxins, or trauma. Always have inflammation, okay? These cells, remember, they get that capillary permeability, they swell, they leak, the fluid leaks out, and they just have a massive inflammatory process. Ischemia refers to the decreased blood flow to tissue or organ and causes a progressive in the disease process. So let's just take a look at this kind of like what's going on physiologic with apoptosis versus necrosis. And apoptosis is on this side and necrosis is on this side. So we have a normal cell and we have something that can cause a cell to die. So cell death following this trauma injury right here. The cell swells. Oops, let's do the new one first right here, okay? So DNA damage, withdrawal of essential growth factors or nutrients, detachment from a substrate, attack of a lymphocyte. So these are occurring and the cell has to die. And this is the normal, which is apoptosis right here, programmed cell death. So what happens? Nucleus fragments occur, the nucleus breaks down, then they kind of break up into little small cell fragments, and then an engulfment of fragments from a sagophyte occurs, eats it up, cell is dead. No inflammatory response. We have no pain, we have no symptoms, nothing. Versus somebody who has cell death from a trauma, a myocardial infarction, a stroke, a motor vehicle accident, and then there's trauma to tissues, whatever. Cell death following an injury. The cell swells, the cell bursts, and look at all this stuff leaks out, all the cell content leaks out. And then we have an inflammatory response that follows. We have these symptoms of inflammation, the redness, the pain, the phagocytes, the white blood cells, the pus, the infection, everything that occurs. And those are two different ways that a cell can die. And we have the physiologic and a pathological way that cells die. So make sure you know the difference between apoptosis and necrosis. And we're kind of wrapping it up here. These last few slides should go pretty fast. So when a cell dies and it becomes necrotic and it dies, like we just talked about, there's different types of necrosis, and I want you to kind of be aware of these different names. Again, becomes important when you start looking at pathology. So necrosis, we know necrosis is the death of a tissue, death of a cell, tissue, organ in the body. Can give a reason why the tissue died. So when we do look at pathology and we see a type of necrosis, it gives us an indication of why the tissue died, because the type of necrosis can give us that information. We know that necrosis is caused by lack of blood and oxygen to the tissue, and we're going to talk about these 4 different types of necrosis that can be categorized by how the cells look after the cell dies. So we can send that tissue and take a look at it, and these are the 4 that I want you to know. Number 1, I'm going to have to write a couple things with this. The first one is that coagulative necrosis. I don't think I only have the pictures here. I apologize. You're going to have to write a few things. This is the most common type of necrosis. It can affect any tissue in the body, but not the brain. Commonly occurs in the kidney, the heart, the liver, when blood oxygen is deprived from a certain amount of time. Okay, so it results from an interruption of blood flow, maybe because of an infarction, because of a blood clot, a stroke, an MI, a pulmonary embolism, a DVT. This is what the cell will look like if it becomes necrotic because of those reasons. Coagulative necrosis. The second one is called liquefactive necrosis, and it is seen in brain infarctions. It's exclusive to the brain. The brain turns into like a liquid. You see that necrosis? Toxins, whatever the toxin is, has liquefied the tissue. So this person has a vessel, we got a blood clot, and this becomes a necrotic part. Somebody has a stroke, somebody has trauma, becomes a necrotic part of the brain. It turns gangrene, or excuse me, it turns necrotic, and it's liquefactive exclusively to the brain tissue. The next one I want to talk about is this, and I should have been the next one, which is called caseous necrosis, and it's seen in the lung tissue. Caseous, think of cheese. It kind of looks cheesy. We would see this in tuberculosis. We see this necrosis for somebody who's tuberculosis, somebody who's aspirated, somebody who has a big cavitation, right? They get a cavitation from aspiration, and that part of the lung dies. Somebody has a massive pulmonary embolism, that part of the lung dies. The necrosis is called caseous necrosis, looks like cheese. And basically what it is, it's caused by the body trying to wall off and kill the bug. So when somebody has a lung cavitation, the lung tissue tries to wall off, the body tries to wall off the bug, block the bug, and kill the bug with the macrophages, and it just engulfs this big mass of necrosis inside of it. And then the last one right up here is the the gangrene. So gangrene, which some of us have seen, probably most of us have seen if you've taken care of patients who are diabetic, right, or have any vascular disease. Necrosis of tissue, impaired blood flow, and bacterial invasion. Usually occurs in the leg because of poor circulation, and this is the farthest from the heart, right? So the vessels get smaller and smaller and smaller and smaller and smaller and smaller. So the small vessels are going to be affected first. That's why we see it generally in extremities like the legs. So a couple things just about the necrosis, the different types kind of helps us determine the cause. From infection, this is a lack of blood supply. There's a lack of blood supply here, and bacterial invasion occurs. And this generally what happens here is there's going to have an amputee. They get this amputated. We don't need a microscope to see this, right? We can see this. So generally, when you're talking about amputees, you're talking about patients who have diabetes or they have terrible vascular disease. Okay, the last slide just is aging. Aging is a progressive loss of tissues and organs over time. risk factors for a wide variety of chronic diseases. So a normal cell just endures stress and damage its whole lifetime, and it changes into this senescent cell, and it's just an older cell, and they just start changing due to environmental stress and damaging. And then these are risk factors for just multiple chronic diseases as life progresses. Thank you.